Assalamu alaikum, everyone, and welcome to this webinar on trauma and grief, coping after mass violence, on behalf of coordinated in partnership with American Muslim health professionals, as well as the Muslim Wellness Foundation, Swiss Muslim Mental Health, and with great support from the kind folks at the ClaremonT School of Theology. Bayan, ClaremonT, thank you very much for hosting this webinar and for helping us live stream this conversation. I'm Yusra Ghazi, Director of Policy and Programs at America Indivisible. And I'd like to get us started right away. We have a number of speakers ready to address this topic with you all. They include Dr. Farha Abbasi, Imam Sohaib Web, Kamila Rashad, Dr. Rukhsana Chaudhry, and Dr. Sabah Maroof. We will begin with Dr. Farha Abbasi. Dr. Abbasi is an assistant professor in the Department of Psychiatry at Michigan State University and staff psychiatrist at the University Student Health Center. She emigrated from Pakistan and settled in the United States in the year 2000 with her husband and 3 daughters. Dr. Farha, please take the floor. I believe you are muted, Dr. Farha.
Okay, can you hear me now?
Yes,
can you guys hear me? Okay.
Yeah.
Assalamu alaikum. Thank you so much for doing this and hosting this. I really appreciate all the efforts and my other panelists. So the thing we have to understand is what is trauma and how does it impact us? Trauma is an intense emotional, physical, mental experience that you feel after something very devastating or distressing event that has happened. Trauma has to be understood in the concept of it can be very specific individual experience, it can be a shared communal experience, or it could be a vicarious experience that is by association. Like right now, we might have people that we know of or knew or relatives or friends that were part of this horrible tragedy. But it also just by association that they were praying, it was a Friday, and these were our faith-based Muslim brothers, sisters, children, that has created this severe, intense anxiety, sadness, and depression in some of us. To really understand the impact of it, we have to understand it that there could be an immediate, urgent impact of trauma. There can be some intermediate, some long-term impact, and then there is persistent impact that lingers on. It depends on the level of exposure, the duration of exposure, the intensity of exposure. Now, if we bring it back to the realm of what is happening to the Muslim community as such. So Pew researchers came out and said Muslims are the fastest growing religious community in the world. But if we take a step back, we realize that major conflicts in the world right now are either happening in Muslim countries or directly impacting Muslims. Every given day, there are more Muslims dying either by these terrorists in name of terrorism or in the war against terrorism. But what is how the trauma is being internalized is what concerns me. So if we just simply look at what is happening right now in our own country, you have a law specifically saying a ban against Muslims. Look at the bullying rates. Your Muslim youth is by far being bullied 3 to 4 times more than the national average. Another research just came out by Pew, which identifies 40% Muslim youth feeling more angry, more alienated. 75% saying that at least one or two themselves or one or two their friends or their relatives have been discriminated against. Look at wearing your traditional religious garb has become a source of threat. But also, you are being looked at with suspicion. You constantly have to come out and prove your patriotism, to your allegiance to the country. You might be born here or lived here for 30, 40 years, but your loyalty, your faith, your everything is being questioned. How does this impact you? It does impact identity. It does impact it has long-term cognitive effects. It can have physical effects. It can have mental effects. So we already know that trauma can be very disrupting. It's like your story is cut off suddenly. It takes away your sense of safety, your sense of predictability, but it can also impact your ability to trust, relate, connect, and you feel very isolated and disconnected. So what we see now, and is the concern for us, all of us who are working in mental health field and in the community, is like, what is gonna be the long-term impact of this persistent exposure to trauma that our kids are facing right now? So we know trauma can change your brain structures. Trauma can change your genetics, now we know. Trauma makes your blood vessels so porous that you are more prone to inflammations, infections. You can have physical health issues like diabetes, hypertension. You are more prone. But we also know Adverse Childhood Experiences Survey clearly is telling us that the higher the rate of this trauma, more chances that you will develop mental health challenges as well. And if you are scoring, it's a scoring of 1 to 10. And if you are scoring somewhere like 6 on those scales, your lifespan can be shortened almost by 10 years. So this is a moment of really intense, a moment to really think as a community, but also as a bigger society, because it's not just affecting one individual. It is affecting community, and when communities are affected, the society gets affected. And if the societies are getting affected, then the country will have impact as well. But what really concerns me, if we really focus on the Muslim youth right now, we can have long-term effects which can impact not only their cognition, their academic journeys, and their personal trajectories. So I think we have to understand that this is not, and we all are living in persistent apprehension that when is the next incident gonna be? When is the next big thing coming towards us? When are we? So what happens is when you are in that state, your anxiety and stress hormones start to rage. And
Dr. Abbasi,
yes.
I apologize. We are wanting to make sure we hear from all the panelists.
Yeah, sure. I wasn't sure about that. I'm sorry. Yeah. This is such an important topic. I appreciate it. And we can move forward. Yes.
Okay. And Dr. Abbasi will be with us for the remainder of the program. We already have a comment in the chat space. As a reminder, everyone, I'm Yusra Ghazi with America Indivisible. Today, we are speaking about trauma and grief, coping after mass violence. And we have a number of speakers here who will be addressing us. We just heard from Dr. Farha Abbasi. Next, we will hear from Imam Sohaib Web. Imam Web is an adjunct assistant professor of public service at NYU's Robert F. Wagner Graduate School of Public Service. He was named a faith leader to watch by the Center for American Progress in 2016 and selected by the Muslim community as one of CNN's 25 most influential leaders, as well as one of the 500 most influential Muslims by the Royal Islamic Strategic Studies Center in 2017. He's currently the resident scholar at the ICNYU, and he will begin his remarks now. Oh, as a reminder, before you begin, Imam Sohaib, everybody can submit their questions and comments in the chat space here if you are on the webinar, and on the chat space at Facebook Live if you are watching us on social media. Thank you. Go ahead.
Assalamu alaikum wa rahmatullah. Can everybody hear me, inshallah? Awesome, wonderful. Bismillah, alhamdulillah, wa salatu wa salam ala Sayyidina Muhammad wa man wala. First of all, thank you all for having me. I know, even though I'm traveling right now, subhanAllah, I'm sitting in a hotel room. These moments of just being with the believers are very healing for me, very powerful and very meaningful. So to hear people's voices who I've known and respected, and then to be just with the broader Muslim community, at least for me, especially I think as a convert, you don't really have a family outside of, you know, your married family, but mothers, fathers, uncles, aunties, cousins, nephews, you guys all represent kind of that metaphorical relationship. So it's great to be with you, and I'm honored to be here. I want to thank also America Indivisible and Bayan and everyone that put this together. The first thing that I think needs to be stated very clearly from a religious perspective is that it is okay to feel the impacts of trauma. I think one of the most greatest successfully irresponsible statements I've ever heard in my life is that you feel anxious or you feel depressed or sad or angry because your iman is weak. That statement is a disaster. We find in the Quran, for example, in the 9th chapter, that the companions of the Prophet are described as hazanan, as being saddened about something. And Allah subhanahu wa ta'ala actually praises that sadness. We find numerous supplications, for example, even chapters in larger books in hadith that would say, for example, the dua, the supplication of the Prophet when he felt anxious. The dua when the Prophet ﷺ wanted to be relieved from hardship and difficulty. The dua, as Anas says, when the Prophet ﷺ ahammahu shay, when something would disturb him and upset him, the Prophet ﷺ would say, La ilaha illa ant subhanaka inni kuntu minal zalimin, or Ya hayyun ya qayyum bi rahmatika astaghith. So if the Prophet ﷺ is experiencing these things, and if the people around him are experiencing these things, then we should not equate the experiences of trauma and stress and anxiety, whether culturally rooted or socially rooted or due to family or due to existential events like we've seen, to having a lack of faith. In fact, the opposite. The Prophet ﷺ, when his son died, he cried. And someone asked him, like, you cry, you weep? And he said, I can't help it if Allah has taken mercy from your heart. So feeling these things is actually the sign that someone is trying to translate and come to terms with very mature, very in tune, very serious feelings. So I think it's very important for people to feel like this is not, you know, correlated with your lack of faith. The second thing is, like, there are some things from a faith perspective that we should try to do when we're faced with these challenges. And number one is that we should try to find a strong supporting cast. We should try to find a good peer group. Fa'wu ila al-Kahf, when the people of Surah al-Kahf, the 18th chapter, were faced with challenges and trauma, they organized together and worked together. And they organized in two ways. Number one was to support themselves. Number two was to strengthen themselves. And number three, and this is very important, was to address the injustice. So I think it's important that we think about organizing for healing, but also moving forward, especially into 2020. And I'm not sure if people saw the tweets of Trump today, as well as others. And then also we organize to address the injustices and correct those injustices. The last point that I'll make are two, and that is that there are times where maybe we feel as though we're struggling. I've been in this situation in my own life, and we need to get therapy. That's perfectly acceptable. The Prophet said, Ya ibadallahi tatadawi, O servants of Allah, seek remedies. You know, sometimes the bar of life just gets too heavy and you need to seek clinical help. And that's why I believe larger Muslim nonprofits and mosques across the country must take partnering with clinicians seriously so that their congregants can have access at least to an intake handled by a professional person, not someone like me, an imam, who's not trained in that subject. So if you feel that you're in need of getting help in that way, again, that's not the sign of you being a weak believer. In fact, Imam al-Ghazali mentions in his book, Ihya al-Ulumuddin, that one of the moments where you're able to talk about things that people have done wrong to you or experiences that you've had that have been, unjust and would not be considered backbiting is in a therapeutic type of situation. The last point, and I'll stop because I want to hear from everyone else, is that we need to see the intersectionality between this issue of Islamophobia, anti-Muslim bigotry, and what, for example, the Black community in America and across the globe has been experiencing for centuries. We need to find the relationships between this struggle and what Latino brothers and sisters are going through, what immigrants are facing, what women are facing, you name it, the pain that is really met by white supremacy as its major catalyst has to be recognized. And when it's recognized, that allows us as a community to open up and even partner with other groups. So the opportunity for working together, the opportunity for finding partners and friends. When we've all been ripped to pieces by hate, we can put those pieces of the puzzle back together when we all recognize that process. So those are things I think that are important for people to know is number one, it's okay to feel trauma. Musa and Harun said, Inna nakhafa, we're scared in Surah Taha. Allah didn't say them, don't be scared. The second thing is finding a strong supporting cast. And this is where true friends come into play and family comes into play. And communities should be offering opportunities for people to come and share how they're feeling and talk through their feelings with trained clinicians. Number three is if you feel, or if someone loves you, says, hey, I think you may need to see a therapist. Again, that's perfectly acceptable. Ya ibadallahi tatadawi, the hadith. And then the fifth is finding the intersectional relationships so that not only are we selfish in caring about our own community, but we're able to extend that care to communities who are experiencing that hatred in maybe even more cancerous forms than our own community. We pray for the victims and the families of this horrible onslaught, as well as all over the world who are subjected to this horrible treatment. Barakallahu feekum. Wassalamu alaikum.
Thank you, Imam Sohaib Web. We are, as a reminder, talking about trauma and grief, coping after mass violence. This is as part of a webinar with American Muslim health professionals, Muslim Wellness Foundation, Muslim Mental Health, and with thanks to the Claremont School of Theology for hosting the webinar. We already have a number of remarks and questions from folks viewing on the webinar as well as on Facebook. Some messages of solidarity. Mariposa says, solidarity among us of all beliefs, cultures, gracias for this unity. On Facebook, we have a comment, salam from all my brothers and sisters from Houston, Texas. We also have some questions that I'd like for all the panelists as we continue to go down the list to consider addressing. One question is about the difference between expressing grief, I think, trauma here in the United States compared to European-based trauma, as well as if there are differences in how different genders express and deal with trauma. We have another question directed to Dr. Abbasi about, as a mental health provider, I'm wondering if someone could speak about ways in which providers can offer practical interventions, tools, coping skills, and strategies to support members of the community, more specifically the Muslim community, in more depth. And we have a question about whether or not we're going to share the recording. We will share the recording. With that, I would like to take us to our next speaker, Camila Rashad. Camila is the founder and president of Muslim Wellness Foundation, a nonprofit organization dedicated to promoting healing and emotional well-being in the American Muslim community through dialogue, education, and training. Muslim Wellness Foundation envisions a future in which faith communities are at the forefront of mental health advocacy and committed to developing an inclusive culture of compassion, understanding, and holistic health. Camila, please take the floor.
Assalamu alaikum, everyone, and thank you for joining. I want to thank my co-panelists and also the organizers tremendously. And we have a short time, so I want to get right to just a few remarks that I'd like to make. And first is to provide some context. And I think Imam Sohaib provided the perfect segue into some of the points that I wanted to highlight around understanding the impact of Islamophobia on community mental health. So I'm going to share a few slides and points. I'll make this available, inshallah, so that people can be able to move forward with understanding the concepts that I'm going to raise. The first piece of context that I would like to provide is the understanding that, one, there's comfort and perspective in being grounded in history. And for us, that history is understanding that Islamophobia is part of a larger system that includes anti-Black racism, that includes oppression of Indigenous people in the US and abroad, such as the Maori people of Aotearoa, New Zealand. And this system that links all of these forms of oppression is white supremacy. And so when we understand white supremacy in a very, very simple definition, is the racist belief that white people are superior and therefore should dominate and exert power over others, and those others being people of color. The consequence of this belief is a very systematic and structural way in which violence is inflicted to maintain this system as white supremacy. And so the massacre in New Zealand, Aotearoa, which is the Maori word for New Zealand, that I'd like to use out of respect for those Indigenous people, this violence is a reflection of the attempts to maintain this power. And so when we see scenes like this, which is of armed white nationalists outside of a mosque following a Muslim woman, this is in Texas, right? So these are images that we are exposed to constantly on a daily basis. And so when we understand not only just the individual impact of these images, these messages around Muslims being inferior, about Islam being somehow evil or oppressive, we are internalizing all of those messages, which then impact the way that we view our communities. And it also impacts the way others relate to us. And so one concept that I would like to share in terms of the consequences of coping with violence of white supremacy is racial battle fatigue. It is the wounds of racial trauma and internalized Islamophobia. So just to begin, provide, again, just very briefly, what is racial battle fatigue? It was a term coined by Dr. William Smith to really talk about the ongoing and cumulative stress that results or that people feel when engaging with others in very hostile or unsupportive environments. Again, think about the Indigenous people in the US, abroad. Think about Black Americans. About 20% of the American Muslim community identify as Black or African American. And so we have to think about the impact on the communities that comprise American Muslims and Muslims around the world. So that Islamophobia is, again, one aspect of the types of trauma. And sometimes we talk about trauma with the big T and the small t, but the trauma just coping and living in hostile, unsupportive environments. And so we see some of the physical symptoms of that being tension, anxiety that you feel in your body. It could be psychological. Just, again, walking through the world, and myself and others who are visibly Muslim or have some markers of being Muslim or being brown or being perceived as Muslim, this constant heightened anxiety that you will be attacked, that you will be targeted in some way. And I personally think one of the most kind of nightmarish sources of anxiety is being in your house of worship, the safest space that you possibly think that you could be in, and experiencing this level of violence. And so the impact of that heightened, that hypervigilance, that anxiety, that anger, an emotion that often we do not talk about, but the anger and the rage that results from that sense of anxiety and of being discriminated against and targeted, I think the impact that we don't talk about often enough is that our productivity, our sense of safety, that our sense of feeling of belonging is compromised. And so think of a community of people, and especially as Dr. Abbasi mentioned, between 35 to 40% of the American Muslim community is between the age of 18 and 29. So we have a generation of people who are experiencing this vigilance, this anxiety. And so I think about for us, and it's the question that we have to consider, is the impact of this community violence on our mental health. Is it in some way obstructing our level of engagement, productivity, of safety and stability? Finally, the hidden wounds of racial trauma include internalized evaluation, so seeing yourself as less than, an assaulted sense of self based on all of those images and messages that you're internalizing, and a feeling of voicelessness, that I cannot speak out of fear of being persecuted, a fear of being mercilessly targeted. And unfortunately, I think our sister Congresswoman Ilhan Omar is the most recent example of what may happen when folks speak up and give voice to, again, the impact of white supremacy and this type of violence. Internalized Islamophobia, I would direct our audience to the Institute for Social Policy and Understanding, which in the 2018 and now 2019 poll is focusing on what happens when Muslims and Muslims in America and also abroad internalize the messages about our faith, which white supremacy says is evil, is backward, is not sort of compatible with modernity or democratic society. We internalize these images and they damage us. So very briefly, and this is kind of my last remarks, I'll say is that the strategies that I think on a community level that we have to consider is addressing this anxiety and trauma openly, plainly, speaking to what the effect is so that people don't start to believe that something is wrong with them, right? But if we can say we live in a system of white supremacy that exerts this violence in order to maintain power, it is understandable for you to feel anxiety and trauma as a result. So I would encourage those to organize town halls, to coordinate ongoing discussions regarding wellness, not just in terms of in times of crises. Form a wellness committee or a mental health first aid team in your local committee so that those are folks who feel equipped to handle some of these emergencies as they happen. And lastly, for those who are interested in learning more about mental health first aid training, which is an international training that speaks to how to help folks cope and manage with others around emotional distress, to feel free to email info@muslimwellness.com. Again, thank you to the organizers. I'll be staying on to answer additional questions, inshallah.
Thank you very much, Camila, for sharing your remarks. As a reminder, you are all viewing the Trauma and Grief webinar, Coping After Mass Violence. We are here on the webinar at Zoom as well as on Facebook Live, and a reminder to all attendees that you can submit questions or comments for the panelists in the chat space on the webinar or on Facebook Live. We had a question come through from Halima asking about trauma related to watching videos of violent events, such as those that were live streamed from New Zealand. She says that we have many youth who are experiencing increased anxiety and even paranoia after viewing the videos. Many people, including Muslims, continue to share videos on social media. So I hope that the panelists will be able to address that in their remarks. And with that, I'd like to introduce our next speaker, Dr. Rukhsana Chaudhry. Dr. Chaudhry is a graduate of the George Washington University. She received her master's in clinical psychology from Pepperdine University and her doctor of psychology from the George Washington University. She's also a graduate of the Harvard University Global Mental Health Program, specializing in trauma and recovery. She currently serves as American Muslim Health Professionals Director of Mental Health Programs. Thank you, Dr. Chaudhry. Please take the floor.
Thank you so much, Yusra, and to all my panelists. I think they've outlined different aspects of trauma and of course, the issue of the collective experience overall. I'd like to just take a moment, and hopefully this can answer some of the questions that have already come up, to acknowledge that piece that that's not spoken of, which is really that this isn't a collective trauma experience. And, when we think about what that is, it is an experience, an event that affects society at various levels. So when we think about what's happened in New Zealand reverberating globally, I think it's important just to know that when we talk about our individual experiences, that we are sharing it with so many people. And one of the ways that we cope is exactly what we're doing here today. And I think, we as individual clinicians and civic leaders and religious leaders, or whoever we are, this is one of the pathways we've taken to kind of work through this. So, and I think that will be, I'll speak about that in terms of how people will move on after this webinar and try to continue their own recovery. So that's something I'll think about today as we talk. One thing to think about, as Farah also mentioned, was something about, our assumptions here that get challenged through trauma. And one of the pieces that's important to remember is, there is a part of trauma, the pre-trauma experience, which is that we believe the world is safe and predictable overall. And we have that assumption in order to keep ourselves safe, in order to keep ourselves moving forward with our daily lives. But this type of trauma that's happened in New Zealand, and we've seen other examples, challenge those assumptions, which is why it really is a shattering impact on society. That it goes within our community and outside of it, which is very important to kind of recognize as we move through this experience, that it's not just the Muslim community that experiences it, and that it's other communities as well, which Camilla also spoke to. So, as these assumptions get challenged, we think about how do we cope? Well, one thing is to differentiate ourselves from the victims who suffered it. An example like this is some people might turn to religion, some people may not. Some people might say, well, they might challenge their own religious faith and think, well, should I have been at Jummah that day? Or should I have, or what about my ability to go to Jummah every Friday? Is that safe? And it might reverberate outside of the Muslim community, challenging their own experience. And how can we be different from the victims who suffered this? And these are kind of assumptions that get challenged in collective trauma experience. And it's important to acknowledge this piece that we all go through. And I think that when there's nothing that you can find that's risky, about that had something to do with the trauma that maybe people had done, such as going to mosque that day, then we are sort of lost as reasoning as to what, what's the cause and how can we prevent this? Because there's no identifiable reason or way to prevent it. And so I think that's when we get into how do we work through this and begin to recover. And hopefully this answers some of the questions. One of the things I want to address is that the first and foremost thing, whether you are part of the Muslim community or not, is to think about your self-care and how you're actually coping with this tragedy. Have you acknowledged your feelings about it? I can't tell you how many rooms I've been in the last 3 days, whether it's through different professional environments or others, where this tragedy really wasn't acknowledged or discussed or brought up. And I do wonder about that in how we as a collective society cope with trauma and tragedy like this. What does it mean when we do not openly acknowledge that the experience is in the room? And that moves towards how do we take care of ourselves in this type of experience? If we don't understand and acknowledge how we are being affected, are we slowed down that day? How have we shared these feelings with non-Muslims or Muslims or our family members? Then moving on to your own emotional experience, kind of acknowledging that possibly other people are having reactions to this. And, that will also impact our own children and adolescents, and we will talk about that. But just to be aware, if they have heard this news and watched these videos, and knowing that when you go into a certain place, other people have experienced something from this, and being able to open the conversation. So one of the pieces that was questions that was asked was the exposure to media. So, as we try to recover from the details of knowing what's happened and understand who's been affected, it is quite important to know what your limit is and how much you can really take in. If it is empowering you to move towards activism, or if it's empowering you to donate to a cause or work with children in a certain way, because we know that has something to do with adult violence, that is one piece of knowing what's happening, but always knowing that there is a limit to what you can handle and without processing what you've seen. If you don't have an outlet to talk about that and you're really taking it in without a family member or a friend to acknowledge those feelings, then that limit is really important for media. And you know, this really will span across generations and also people who have suffered trauma themselves prior to experiencing this as a collective trauma. That limit is really critical to knowing what can re-traumatize you or what can re-traumatize populations, and being able to help people work through this idea of how much can you take in. You know, and I think some of the other pieces that we can touch upon is the idea of resilience and how do communities, you know, experience this, but also remain resilient. And one of the things I mentioned was being active in some way, that oftentimes that's a principle and a idea that does help people who have suffered trauma, whether it's a shared trauma like this or an experience where it's an individualized experience, you know, moving towards a place where you can take a step and utilize that acknowledgement of feelings to work with a certain cause or another group that is going to reduce some of the possibility of violence, and it could just be donations and things like that. But when you are moved to do that, that's a really important part of healing and recovering, and also feeling that your assumptions are not completely insecure at times. You know, we have to kind of hold on to some of them in order to move forward and progress. And so that activism is really critical. One of the other pieces that I had talked about was sharing your experience with others. And Camilla did talk about this a little bit, but being in certain rooms and beginning to open a conversation, whether it's through mental health first aid or another conversation even in your workplace about how you all have experienced it, taking steps to soothe yourself and others, and then trying to build some positive continual conversation is a really important possibility for recovery. You know, again, something that happens a lot is our desire to deny the impact of trauma. And we always have to acknowledge and be critically aware that is something that happens in every individual, because it can be intolerable to experience the effects of what's happened, whether you are close to the experience or far away. And we do want to understand that media too, and being aware of how that also happens through what you take in through media, and the denial and the lack of expression of victims' experience impacts us, and how if we don't see it in the media, we will also kind of get caught up in that ourselves within and outside our community. So those are some of the things I wanted to touch upon in terms of resilience and forgetting the process of recovery. And there's many more, and I think we can have a more fruitful discussion in the Q&A.
Great, thanks very much, Dr. Chaudhry. We have been pretty overwhelmed with a number of questions and comments in the chat spaces and on Facebook and here on Zoom. And so as a reminder to everybody, we're talking about trauma and grief, coping after mass violence. And before we go to our final speaker, Dr. Saba Maroof, I just wanted to read briefly some of the comments and questions that are coming in, and we hope to have some time toward the end to address them. We have questions related to just the feeling of disappointment. So should I feel disappointed of other Muslims that are not affected by the tragedy in New Zealand? It seems to me that they just don't care. That's one question. We have a couple related to politics. Do we need to do anything politically to speak about white supremacy? How do we as individual providers interject political realities when supervisors and traditional organizations censor discussion? There are other questions about what is the role of the creative arts and creative art therapies and how they help address trauma. This is from someone who is a dance and movement therapist and works extensively in the area of mental health. Another person just reflects and asks, is it enough to seek support from Allah subhanahu wa ta'ala? And on the religion front, I think we had another question from someone asking for Imam Sohaib to provide the ahadith via this webinar chat space or email that he mentioned. And I'll keep reading off in between our speakers some of the other questions that are coming in. But at this time, I would like to go to our final speaker, Dr. Sabah Maroof, who is a child, adolescent, and adult psychiatrist practicing in various outpatient settings in the Metro Detroit area. Since completing her training, she has been actively involved in providing psychoeducation through talks and organizing seminars and workshops in her local community, as well as being available for consultation on matters pertaining to mental health. Dr. Maroof, go ahead and take the floor.
Sorry. Assalamu alaikum, everybody. Thank you so much again to the organizers for putting this on today. I think it's really important just from the conversations that I'm having from friends, from the community. You know, we're definitely all ourselves really from this. And as a Muslim mental health professional, it's, you know, we have the skills. Yes, we're in the know in terms of like how to deal, you know, theoretically with issues like this, but it still affects all of us. And I think it's really important that we are addressing it in this way as well. But in terms of, you know, I'm definitely getting a lot of questions on how to handle this with our children. I'm a child psychiatrist. I'm also a mother of 4. My oldest is 12. My youngest is 4. So it's interesting because, you know, of course, the biggest thing is understanding and realizing that children are going to be impacted and it's going to affect them in different ways depending on their age. The biggest thing, and I'm going to reiterate too, that many of the speakers have already mentioned, is it really kind of starts with us in terms of our own processing of the events and how kind of, again, we're processing that, how we're, you know, allowing ourselves to feel, kind of giving ourselves permission to feel a certain way, definitely as Imam Sohaib had mentioned. So it kind of starts with us. And also to reiterate that if you are at a point where you're feeling very overwhelmed and, you know, extremely, you know, sad, then that's also a time to unplug as well. As we are trying to help our children, you know, we're going to kind of help them navigate this for themselves. We also need to take care of ourselves. And I always go back to the analogy of, like, you know, the face mask, an oxygen mask in an airplane, always making sure that you're taking care of yourself first so that you can be there mentally and physically to take care of your children and your families. So I think that's kind of the first thing, is kind of taking some time to just, again, be with yourself and process it, you know, as we do as individuals, with other people as well, our family, friends, community. Now we're kind of, when we're moving on to our children, of course, we kind of want to prepare ourselves on, like, how do we talk to children? And of course, the big thing is it's going to depend on their age and also kind of like where they are at, you know, developmentally, if they're young for their age, or if they, you know, pretty much, or if they're mature for their age, kind of taking that into account. So of course, how we talk to a young child that's like 5 or 6 years old is going to be very different than how we talk to a maybe an 8-year-old is going to be very different from how we talk to a 15, 16-year-old. And also that's, of course, that's going to depend on what they know about it. So with a child that's very young, you know, between the ages of like 3 and 6, they probably haven't heard much about it. They probably haven't heard about it. And I mean, I don't think that necessarily we have to share kind of everything that's going on. This is kind of a time where you might also take stock of, like, what's going on in your house, what the environment is like in your house. Is the news like always blaring in the background? The CNN kind of always on with the headlines. And I think many people are kind of more aware of, like, how that impacts the household environment. But that's something that you definitely kind of want to minimize in general. In general, it's not really good to have all that background noise already, because we know that it can impact kind of how we're all mentally functioning, can affect our functioning. So for that younger age group, we were going to want to avoid, of course, sharing maybe horrific news or like details or anything like that, or talking to them about it. I mean, it's not really appropriate for that age. Also, with children that age, they have a really hard time. They might have a hard time with like images. They tend, and also they're going to tend to, of course, worry about, if they do know about it, they're going to worry about they're going to take it back to themselves. They're going to worry about, of course, their own safety. But and of course, if you suspect that they might know, that you might want to ask them why they are upset. And really, if they need to know if they've heard something about it from an older sibling or something, or if they have, then again, you can address it with them in very kind of more, you don't want to give a lot, overburden them with a lot of details, but that really reiterate their safety, that they're safe, that that mommy and daddy or mommy or their family, they're here, they're always here for them. We're here to keep them safe, and that Allah subhanahu wa ta'ala is always there to keep them safe as well. So kind of what I'm saying is that, I think to keep it kind of simplistic, definitely at that age, but focusing on reassurance too. And if they do have older siblings that might know what's going on, then also talking to the older siblings, saying, that this age they might not be as they're not really necessarily prepared or able to process this information. So we're, not to joke around about it. I don't think that any older kids would, but you know what I mean? Like kind of limiting that a little bit. Now, kind of like the middle stages, 7 to 12, that's kind of when they are talking to friends. That's when some kids might have cell phones in that age range. So we kind of want to see kind of what they know. And so that might mean sitting down and asking if kind of taking stock and seeing if they've heard anything. When we're talking to younger teenagers, they will have heard. I think the big thing actually is that after you've kind of focused on how you're feeling, the self-care a little bit, you kind of also want to talk to your own children about it. Of course, if they're a little bit older, and you kind of want to make sure that they're kind of hearing it from you. Maybe they've heard it from somewhere else already, but you do want to find out kind of what they know. And assume that they know. Don't assume that their knowledge is going to be complete. So they do need you there to kind of fill in the blanks, to correct any kind of misleading information, flawed information, and know that they're talking to their friends, but know that let them know that you are there to provide. You're there to answer their questions and provide a safe space. Number one is listening to them. Finding out what they already know, let them know again that you're there to listen. Sometimes as parents, we want to jump in with problem solving and like trying to, troubleshoot. But again, really, it's important just to kind of first get an idea of what they know and listen, and don't jump into problem solving mode. If you're really upset, and many of us are, if you're very upset about what's happened, you also don't want to project that necessarily onto your child. There might be some kids that have heard about it and they're taking their time to kind of process it. They might not necessarily show that they're really upset. They might be thinking about it. They might not be showing that. And that's okay. It might be okay. It's okay if they haven't really, their understanding is, they're not necessarily jumping to like catastrophizing it, or you don't want to basically project kind of your anxiety either on them. Children are constantly observing us all the time, and how we're responding to events, how we're talking about it to other people, how we're talking about it to our neighbors, to our, to our friends, to our relatives on the phone. And it's okay to let teenagers, know how you are feeling, but again, you don't want to kind of overburden them with your emotions. You also don't want to minimize their feelings either. You don't want to minimize their feelings by saying, well, don't worry, there's nothing to worry about, because they are worried. They have anxiety about it. So listen and validate that it's normal to have those emotions. We don't want to minimize their concerns. Also help them label their emotions too. Children, teenagers, even if they're a little bit older, they're still going to need sometimes some help in naming their feelings. We call that like an emotional vocabulary. So they might need help kind of labeling their feelings into words. With younger children, if they have heard about it, they again might not be talking about it, they might not be verbalizing it, but things that you can encourage them to do are drawing. You might see them expressing themselves in their play, and that's okay. That's definitely something that's very developmentally like normal, in a way that they're kind of processing again their own feelings and their own beliefs about kind of what's happened. So, you know, again, with the conversation with your teenagers, though, take cues from them. Again, don't overshare, don't necessarily overshare a lot of details and information. I know there's a lot of details coming out about what happened. Just as we want to kind of know what our own limits are, we kind of want to know what our limits are for our children too. This is a very, very, you know, these are really heavy topics. This is a significantly, I mean, it's a traumatizing event. So we're kind of shielding our children a little bit, but also kind of helping them, again, to verbalize it and to find the kind of the words to describe what is happening, what they're feeling. Another thing is to kind of simplify and correct. So for teenagers, you know, they're also in a phase where they're kind of in a developmental phase where they're questioning their identity. They're wondering they're formulating how the world works, what their place is in the world, how things impact them. And again, you want to emphasize their safety, that you are there to keep them safe, that they do have adults that they can trust, that are there for them. And that, you know, that the world, you know, these things happen. But the world in general, there's many good people. And we kind of want to emphasize that too. It's easy, I think, as adults even, and I'm sure many of us are feeling it, is to look at the negative and the evils of the world. We don't want to pass that on to our children. That, and you know, Islamically too, we want to keep hope alive, right? We want to emphasize and make sure that our children understand that there is so much good and there is so much positivity. I know that some of the concerns that we've had as adults, I know from my own friends' conversation and what Roxana had just mentioned too, is a little bit of feeling that our coworkers might not be understanding like why this is a big deal. I've been hearing this from a lot of people that there are friends that have reached out. There's maybe some people that haven't made the connection of why this is a big deal for us. Something that you might want to do for some of your kids, depending on how it's impacting them, is reach out and communicate with the teacher. The teacher, if their teachers haven't reached out to you, just say, you know, we're particularly impacted by this event that happened, but this tragedy that happened in New Zealand last week, and maybe just kind of letting the teachers know, like bring some awareness to them, especially, of course, if they're not in Islamic school. That might be something that's helpful too, that they can kind of look out for their students and their other Muslim students as well, and just be there to show them some support when they're in the school environment, because they're spending the majority of their day in the school environment.
Dr. Maruf, I would like to ask you to wrap up remarks. Yes. We have a few more minutes left. We want to make sure to get to final comments from other panelists and address some of the questions. Okay, yeah, I mean, that's pretty much it. I think the other big thing is that, as with anything, this might be a series of conversations. It's not necessarily going to always be, as with many things, a big sit down one-time talk, but being prepared to be there for your children and your teenagers for a series of conversations as they continue to kind of process this tragedy. But you're there to help them with it, that they have support from their parents and from their teachers, and maybe also reaching out to your children's friends, their parents, and, you know, seeing what you can do collectively also as a community to kind of, you know, address this as well. Thank you. Thank you. Thank you, Dr. Maruf. We are, if you're just tuning in, we are talking about trauma and grief, coping after mass violence. While you were speaking, Dr. Maruf, we had a couple comments come through on the Facebook Live. I think it's also important, Saud says, I think it's also important, along with telling children they're protected, to point out the tangible, real support from non-Muslim communities, and to take children to vigils, show them pictures of support. We also have a number of questions that delve into the areas of sources of fear, and then also questions associated with faith. And so if I could just summarize some of them, somebody asks Imam Sohaib to say, are there specific religious texts that address instances like this when non-Muslims attack mosques or masajid? A couple different questions from individuals who wonder how to deal with the decisions of whether or not to continue wearing hijab and the anxiety associated with it, the real risks associated with it, personal, spiritual, professional. And then someone who says in the comment space, I feel like it's not safe anymore to live in a non-Muslim country, and I want to live in a Muslim country and not be asked stupid questions like, does my hijab make me feel hot during the summer, and on and so forth. So some religion, faith, and fear related questions, some related to hijab. So what I'd like to do in our last few minutes together is to go right back around to all of our panelists. I'd like to ask you in about a minute or less, so that we can make sure to end on time, to address any of these questions or offer any final remarks. And as a reminder to everybody here, you can like our respective organizational social media pages. The recording and additional resources will be sent out through the American Muslim Health Professionals and other partnering groups. So with that, I'd like to go right back to Dr. Farha Abbasi to share any final remarks for the webinar before we close. Dr. Abbasi, I think you are on mute.
So I think it is very important, as we are coming together as a community, not to forget that we do have a lot of support and resources beside our community, outside our community. We have to focus on shared experience of humanity. And we have to draw strength and resiliencies from all possible resources. And do not forget that some of these experiences are being shared by other faith-based communities, minorities, and we talked about historical trauma. So again, let's just continue to come together and heal together. Thank you.
Thank you very much. Next, we'll go to Imam Sohaib Web, if he's still on, with any final remarks. And I don't see him on, so maybe we'll skip him for now and go directly to Camila Rashad.
Assalamu alaikum. One, I would say, and this is a reminder to myself, first of all, to take a deep breath. I think, we often feel the impact of the anxiety in our bodies, as someone in the chat mentioned. And so just the simple act of breathing and being grateful for that breath is a place that I try to start. The second thing that I'll say is that it is okay to unplug, to disconnect, to sort of recuperate and to rest. I just have to share personally that the youngest victim of the massacre, his name was Muqad Ibrahim, was 3 years old, and my youngest son is 3 years old. And in fact, they resemble so much that if you put their pictures side by side, they look like brothers. And that was the moment for me that I had to kind of pause and cry and take a deep breath and pray for the family members who are surviving and trying to understand this. And so I would say to everyone to give yourself permission to not constantly be plugged into the latest updates about what's happening, that we all have to take a step back and just replenish, maybe hug someone, send someone a message, call someone just to say, I'm thinking about you, to accept those messages that we also receive from other people of other faiths and communities, and to really appreciate the moments that we do have, and not feel guilty, right, for taking those breaths and for taking those moments to pause.
Thank you so much. And for final remarks from Dr. Rukhsana Chaudhry.
I would just say that, as we all try to recover and move forward in some way, that experience of acknowledging sort of the victim's experience and being able to, if you are processing it by shedding a tear or experiencing their story by reading it, that really is critical, that when you process and you experience something in terms of a victim's experience, that opens us up to being able to share, an experience with other people and to deepen our empathy. And that moves us towards something unifying, that we can all kind of come together in the empathic experience and increasing our society's ability to do that. So that's one thing. I also want to make a note that, my own husband had been at his mosque on Friday doing Jummah just in order to be, you know, with his community. But what was fascinating and what I've seen, you know, through much of social media is how many other faith communities joined in prayers with our community on Friday, and how critical that is in healing, to be able to cross those boundaries with other faiths, invite them to pray with you, invite them to process what's experienced, but also be together in that interfaith connection, and that how that is the most healing. And you don't have to necessarily go into the media experience to heal, right? That you can find it through connecting with the other communities. That is the very crux of what, you know, what may feel like is, you know, the divisions being a problem, but just being able to connect with the other faiths, even if it's, and if anyone is reaching out to you, that's great, but you might reach out, or you might find a way to be in an interfaith circle and really learn a little bit about, okay, maybe this is a pathway to move all of our society forward. And it really is important when you're recovering from a trauma like this to recognize there's people outside of your direct experience that do have empathic ability to be with you. So I was very touched by that. And I do think it moves us towards healing.
Thank you, Dr. Chaudhry. Dr. Maroof, you have the final word.
Thank you so much again. I really appreciated everybody's contributions on this panel, and honored to be on the panel. And I mean, I definitely reiterate what everybody has already said. I think that really leaning in to our village, whether that means our family, our community, across, as Dr. Roxana mentioned, across faith groups as well, is really important. And when our children see that, then that's kind of the best way that we can model how to kind of deal with how we deal with these kind of tragedies. And then I think also modeling hope and strength in our identity as Muslims is really important for our children, that we do have something huge to be proud of, and also them seeing us putting really our trust in Allah subhanahu wa ta'ala, and channeling any of those negative feelings or doubts or hopelessness into meaningful contributions, and then also into our faith and into our prayer individually, collectively. So I think our children and teenagers see us doing that, and that helps them restore their faith as well, inshallah.
Thank you, Dr. Maroof. As a reminder to everybody, you can access this Facebook Live anytime at the Facebook page for American Muslim Health Professionals. We will also plan on sending out the recording. Today, we were speaking about trauma and grief, coping after mass violence. And I want to end with my deep and heartfelt thanks to the attendees, for folks who were in the chat spaces offering their reflections and questions, to our speakers for taking your time and your energy to address us, and also to Muslim Wellness Foundation, Swiss Muslim Mental Health, American Muslim Health Professionals, and a heartfelt thanks to the Bayan Claremont, the Claremont School of Theology, for hosting this webinar on their platform. Again, I'm Yusra with AmericaIndivisible.org, and I hope you all have a restful and meaningful day. Thank you for joining us. Assalamu alaikum.
Thank you.
Thank you.
Assalamu alaikum.